AI, if you feed it garbage, you're going to get garbage outcomes. There's been a lack of transparency in decision-making processes and the risk of reducing vital human interaction and judgment. It's not far because we see that about 60 or 70% of patients in the United States are apprehensive about the involvement of AI in their care at any stage. Welcome to our new episode of Unmuted, the Diaries of the Virtual Psychiatrist. I'm your host, Dr. Muhamad Aly Rifai, and today we have an interesting topic. We're going to be talking about artificial intelligence in psychiatry and medicine. Is it a revolution or is it a reckoning? We are in a dazzling age. Medicine stands at the frontier of artificial intelligence, an artificial intelligence revolution. It's a technological force that reshapes everything from diagnostics to patient communication. And the rise of artificial intelligence really promises to enhance patient care, clinical medicine, psychiatry. It offers precision, it offers speed, and in some cases, even superior empathy. Yet, as we enter this new era where we embrace this brave new world, we really must tread very carefully. Like any powerful tool, AI comes not only with transformative potential, but with significant pitfalls and peril. So let's take a deep dive. What is artificial intelligence? We doctors and psychiatrists usually like to know what are we talking about when we discuss artificial intelligence. Fundamentally, it refers to systems or machines that really simulate human intelligence. How does it do that? We really don't know. I mean, the scientists who had developed it put some deep learning models with multiple layers to try to see if they can simulate human intelligence, and they've been successful so far. They've been conditioning those machines to perform tasks such as visual perception. So, facial identification in cases of medicine, reading radiographs, speech recognition. Not one day passes where there's a new program that does dictation for physicians and listens to the patient's and doctors' encounters and transcribes it into notes. It also helps with decision making, decision trees, language translation. Invariably now we have all of these machines, all of these small phones that translate. You have a patient who only speaks Spanish or another language, and you just have him talk into a phone and it's beautifully translated into English. Now, at its core, AI, artificial intelligence, functions by analyzing vast data sets. It uses algorithms. It uses what we call machine learning, so patterns of learning new things that the machine didn't know before. And these algorithms really allows computers to identify patterns and predict outcomes. And this is one of the most areas where artificial intelligence has been very successful. It digests large data sets and gives us predictive modeling of what's going to happen. Same thing with mortality data, same thing with patient data. It looks at different things and it's able to digest a large volume of data and gives us some predictive outcomes. And we have seen that AI has improved their performance over time without expensive and explicit programming. It just gets better. It analyzes more data, gives you outcomes, it learns from it, it gets better, and it gets better. And this is why we see, for example, genomics that's operated by AI. It looks at large data sets of patients and their genome and gives you outcomes. Patients with this pattern of genome are more likely to develop these kinds of diseases, these kinds of cancers. And that's why we're seeing that how these models are being implicated in medicine. We've also seen it in patient risk stratification, personalized treatment recommendation, and even in robotic surgical assistance. Basically, it predicts what are the moves that it's going to do during a surgery. However, despite all of these promising advancements and capabilities, the integration of AI in healthcare has been fraught with ethical complexities, concerns about data privacy, potential biases in AI algorithms due to skewed data sets. Because with AI, if you feed it garbage, you're going to get garbage outcomes. There's been a lack of transparency in decision making processes and the risk of reducing vital human interaction and judgment. It's not far because we see that about 60 or 70% of patients in the United States are apprehensive about the involvement of AI in their care at any stage: dictation of notes, making decisions, radiology, laboratory, predictive outcomes. They are apprehensive about a machine taking care of them. So, addressing these ethical impasses requires a robust regulatory framework, transparent practices, and really active clinician involvement to ensure that AI is really aligned with ethical standards and patient centered care. So, let's dive in also at the profound benefits of what AI has brought into medicine. We've talked about AI technologies that were able to analyze vast amount of patient data with unprecedented accuracy. It assists patients and physicians in diagnosing diseases earlier and more accurately. And fundamentally, we've seen pictures of artificial intelligence interpreting x-rays. The most profound model is its ability to interpret x-rays, mammograms, and will show you how it is able to predict by digesting large amounts of data which speck that it sees on a mammogram in term that is going to develop 5 years later into cancer. It looks at the patterns, it looks at progression, it looks at the size, it looks at other characteristics. And with large modeling and machine learning, it is able to tell you this spec has probably a 90 to 95% chance of becoming a breast cancer 5 years later. So it flags it. Also, imagine an AI guided surgical robot, a technology not just for the future, but it's actually being used today. It helps surgeons perform more intricate procedures with unparalleled precision. No more handshaking, no more inability to work in small spaces. It significantly reduces complications, significantly reduces recovery time, better outcomes, especially if you're talking about a neurosurgical procedure in very sensitive areas where a small difference would make a difference between somebody being able to talk and somebody not being able to talk. We've also seen that AI driven predictive algorithms are being utilized to anticipate which patients are going to get worse, patient's deterioration. So when a patient comes into the hospital, if they have certain parameters, AI is able to tell you, be careful. This is a patient who's going to fall apart on you in the hospital. You better take care of them. You better give them as much as possible care because predictive AI tells us that this patient has a high chance of mortality and morbidity during their hospitalization. Thus, it saves lives and enables timely interventions. Yet, this AI revolution carries significant shadows. A recent study published by JAMA, published this month, highlights ethical concerns about AI's permeation into healthcare. As we said, many patients continue to be very apprehensive about AI involvement. They're also unaware of how much AI is involved in their care, from diagnostic imaging to predictive analytics. And ethically, patients have the right to transparency. They need to be able to know that AI can really empower their physicians to give them better care and help them recover faster and have better outcomes. But patients are apprehensive about that. We said 60 or 70% of adults expressed discomfort at the thought of AI guiding their medical decisions, citing fears about accuracy, privacy, and the loss of human touch. We also know now that there are issues of legal liability. What happens when AI tells you to do something or gives you a guidance toward patient care and the patient has an adverse outcome? Are you going to say, well, AI told me to do so? We are seeing proliferation of cases like that. Now, the funny part is that we're also seeing the legal profession adopting AI, and we have seen cases where AI has had bad outcomes for attorneys that were sanctioned. They delegated the drafting of complete briefs to AI, and AI, in its wisdom, fabricated and came up with legal precedents, legal cases that do not exist, never happened, but puts them in there as evidence that what the lawyer is arguing for is supported by precedents. And we've seen many lawyers who have been sanctioned because they have utilized AI in their briefs. We've also seen some courts that decided they no longer will agree to have any lawyer utilize AI in the drafting of briefs. Let's go back to medicine. We really think, both in medicine and law, that the transparency about AI usage isn't just ethically necessary, it is crucial in consumers, clients for lawyers, and patients for doctors because of the trust and engagement and to keep people involved in their own healthcare. Also, that we've seen AI being involved in data, data analytics, understanding data. And as I said, it is very important to see what data is being fed to the AI because that really predicts the outcomes that we get from AI. I wrote an article several months ago on the Kevin MD blog and really underscored how data inaccuracy can cost lives and money in healthcare. We have seen sometimes when AI was used in legal prosecution of physicians. In my case, AI told investigators that I have sent bills on deceased patients, only later on to find out that these patients actually died before I was born and that AI fabricated the whole thing. An error in AI interpretation can ripple rapidly, leading to misdiagnosis, legal implication, inappropriate treatments. And we must vigilantly oversee these systems and ensure that rigorous standards for data accuracy and algorithms really ensure transparency and reality. Now, let's go and talk about what is going on in psychiatry and with artificial intelligence. AI and genetics, large language models, predictive analytics. AI is able to look at our genome and is able to tell us whether some patients are susceptible for psychiatric issues, such as depression, anxiety, and bipolar disorder. It is also is able to provide a personalized treatment strategy. It looks at medications, and it's able to tell people what medications are they likely not to have any adverse outcomes for, and which medications they're going to more likely be able to take on a long basis and be able to respond to. We are not yet at a stage where AI is able to tell us which psychotropic medication is best for the patient. Also now AI is being integrated into treatment for depression, anxiety, and PTSD. A company called Gray Matters has used an AI-driven neurofeedback system called Prism to help patients retrain their brain activity significantly to improve outcome for those who are suffering from depression, anxiety, and post-traumatic stress disorder. However, AI can never and must never replace the empathetic, deep human interaction that is very essential in psychiatry. And a careful balance is really required to ensure that AI augments rather than diminish the quality of care. Another example that we can talk about in AI in psychiatry is actually related to visual perception. Psychotropic medications can cause adverse effects in patients who are receiving those medications and can lead to a condition called tardive dyskinesia, TD, which is a debilitating side effect of psychotropic medications. And it's characterized by involuntary movements of the face, the tongue, the neck, the hands, the lower extremities. And these are things that AI can pick on. A groundbreaking study recently published demonstrate that AI algorithms using video data can detect tardive dyskinesia with greater accuracy than trained human raters because it picks those small movements that humans may not be able to pick on. It achieves higher sensitivity and specificity. And this technology allows for rapid, remote, and accurate screening and enables psychiatrists to intervene early and potentially alter the course of treatment, vastly improving the patient's quality of life. Another application that they are really working on involves feeding AI large data sets of facial features, exactly like right now, and somebody who is producing speech. And the company is hoping to integrate or feed the AI model data of at least 20 to 30 million individuals associated with that, with those data, whether the individual has any psychiatric issues. The company is hoping to develop this AI model that is able to tell whether somebody has a likelihood of having a psychiatric illness just by analyzing a 1-minute video of speech, facial features. That project is ongoing. Whether it's gonna be we're gonna be there, I think is questionable, but they are trying 1 minute of speech and interaction, and the AI model is gonna be able to tell you whether you have any psychiatric problems. Further highlighting AI potential is also research from molecular psychiatry, the possibility to uncover patterns in our genome that are complex that would tell us who is likely to have depression, anxiety, schizophrenia. We can enhance diagnostic precision. We can tell if somebody is likely to develop dementia, Alzheimer's disease, and can really tell us whether we should intervene early. These systems are really integrated and can really help us predict psychiatric illness for the future. Now, one particularly captivating aspect of AI involvement in psychiatry is therapy. Now, we talked about our patients craving empathy and human interactions, but they brought in chatbots into therapy, and they have really surged in popularity and have dramatically expanded access to mental health services and offers immediate and stigma-free and scalable therapeutic support. These digital tools provide immediate access and continuous monitoring, crisis support, and even personalized cognitive behavioral therapy interventions, and demonstrates that those things could be provided by a chatbot safely. I don't know how patients would feel. They have told us 60-70% of them are apprehensive about the involvement of chatbots in therapy. There are significant risks that are associated with this rapid adoption of AI. The American Psychological Association and the American Psychiatric Association, of whom I'm a fellow, talks about chatbots and think that they may sometimes oversimplify complex psychological issues, misinterpret patient communication, or even provide inaccurate or potentially harmful advice. Who's going to be blamed if a chatbot gave the wrong advice to a patient who is experiencing suicidal ideation and they ultimately ended their own life? The absence of human empathy, intuition, and professional judgment that is being replaced by chatbots and AI can really lead to misunderstanding, misdiagnoses, and compromise patient safety. So while this chatbot technology is promising, careful regulation and continuous oversight is really, really needed. As healthcare providers, it is our ethical duty to advocate for responsible AI implementation that is transparent and patient-centered. rigorously validated. We have to validate, validate, validate. Like in medicine, like in research, we develop a parameter that's called inter-rater reliability, meaning, do all raters agree on the same thing that they're seeing? And what's the likelihood of all having the same impression of the same clinical scenario? We really need to have AI have that reliability. Let's not merely chase the seductive efficiencies that AI offers. Let's demand a system that amplifies human strength, maintains our ethical commitments, and genuinely improves patient outcome. As we conclude, AI is undoubtedly the future of medicine, whether it is helping a surgeon in a complex surgery, neurosurgery, abdominal surgery, whether it is helping a psychiatrist identify adverse effects of medications, tardive dyskinesia, or whether it is identifying the possibility of psychiatric illness or looking at somebody's genome to see if they're susceptible to psychiatric illness or whether they're going to be able to tolerate their psychotropic medications. Whatever that application, AI is here to stay. And we have to figure out, what is this future going to be? It's a bright future, but possibly fraught with complexities and pitfalls. AI holds the power to profoundly enhance our capacity to heal, yet equally carries the potential for significant harm if mismanaged. As physicians, patients, and policymakers, we must work together to harness AI's revolutionary promise and ensure that medicine remains compassionate, equitable, and deeply human. And we should resist the temptation of delegating everything to AI because that will take away our humanity. Patients don't want that. Patients want AI augmented patient care. They want to be informed. They want to know at the door, your physician is using an AI model to dictate your note. Your physician is using an AI model to take a look and see whether you're part of a cohort that is likely to decompensate when they're hospitalized so they can give you more attention. Your physician is using AI to predict whether your medication is going to be effective for you, whether your antibiotic is going to be effective for you, whether you're likely to have a heart attack if you don't take your medications. Your physician is using AI to assist in your surgery. And finally, your physician is using AI to look at large outcomes in large data sets of humans to see which one can do better. AI holds a significant future and a revolutionary promise, but we have to be careful of this future. On this note, thank you very much for listening. Until next time, let us approach this digital frontier thoughtfully, ethically, and passionately committed to patient care. AI is here to stay. Let's embrace it, but let's be careful. I'm Dr. Muhamad Aly Rifai, the virtual psychiatrist unmuted.